Does plastic surgery post-op monitoring vary by procedure? Imagine going through a plastic surgery procedure and wondering how your recovery might differ from someone else's. The truth is, post-operative monitoring is not one-size-fits-all. It varies quite a bit depending on the type of surgery you have. While all procedures follow basic safety principles, the specific monitoring protocols are tailored to the unique needs of each operation. Every patient, regardless of the procedure, needs regular follow-up visits with their surgeon. These visits help assess how well the healing process is progressing. During these appointments, the surgeon checks the surgical site, manages dressings and drains, and looks out for signs of infection or other complications. Suture removal, for example, usually happens between 5 and 21 days after surgery, depending on the procedure and how quickly the tissue heals. Patients are also advised to watch for warning signs like fever over 100.1 degrees Fahrenheit, excessive bleeding, persistent swelling, redness, warmth, or unusual pain around the incision. However, the intensity and focus of post-op monitoring change based on what kind of surgery was performed. For example, procedures like tummy tucks, liposuction, or Brazilian butt lifts involve significant tissue manipulation and often carry higher risks of fluid buildup or swelling. These patients might need lymphatic drainage massages starting within a day or two after surgery to help reduce swelling and promote healing. They may also have drains placed to remove excess fluids, which requiring careful management. Drains are typically emptied 3 to 4 times a day, and their output is recorded to monitor for signs of abnormal fluid accumulation. In contrast, less invasive procedures like small facial surgeries or minor contouring may not requiring drains at all. The recovery timeline also varies. While most patients are advised to limit strenuous activity for about 6 weeks, some procedures may need longer or shorter periods of activity restriction. For surgeries involving weight-bearing areas or extensive tissue trauma, doctors tend to be more cautious, extending monitoring and activity restrictions to ensure safe healing. Early recovery protocols also differ. All patients need rest and elevation initially, but how quickly they can start moving around and resuming daily activities depends on the procedure. For example, patients who undergo lower limb surgeries or extensive body contouring need careful monitoring for blood clots, especially during early ambulation. The risk of deep vein thrombosis is higher in longer surgeries or those affecting circulation in the legs, so doctors often recommend specific precautions. Certain patient groups requiring even more careful monitoring. For example, individuals with obesity or those who have had significant weight loss surgery need special attention to airway management, positioning, and overall safety. These factors influence post-op care plans and monitoring protocols to reduce the risk of complications. Follow-up schedules are also tailored. The first check usually happens the day after surgery, often virtually, especially if lymphatic massage is planned. The next visits typically occur around 6 weeks after surgery to evaluate healing and determine if patients can gradually resume normal activities. The specific focus of each follow-up depends on the procedure, with more extensive surgeries needing closer observation. Throughout recovery, communication between patients and their surgical team remains vital. Promptly reporting any unusual symptoms or concerns helps catch problems early and ensures safety. Surgeons give detailed, personalized instructions based on the specific procedure, and following these guidelines is key to a smooth recovery. In summary, post-operative monitoring in plastic surgery does vary based on the procedure's complexity, location, and the patient's individual health. While core safety principles stay the same, the specific protocols are adapted to meet each surgery's unique needs. Always consult with your surgeon for personalized advice, and remember that careful monitoring and communication are essential for safe, successful healing.